Are there women that absolutely should not get the O shot? Curious about the O shot but unsure if it's suitable for you? Join us as we unravel the truth about this popular procedure and explore whether there are certain women who should steer clear of it. In this eye opening video, we delve into the factors that may influence whether the O shot is right for you. Stick around until the end to hear about one way the O shot has helped many women. Today, we're going to be talking about the O shot for you ladies out there who are curious about if this is a good procedure for you. We will be answering all the questions you've ever had. I'll be talking about how it works, what the treatment options are, what it looks like, what the results are, and who should or should not receive this treatment. The chapters of this video are in the description below, in case you wanted to skip to anything. Don't forget to like and subscribe for more content like this. And let me know in the comments, what's your opinion of the O shot? Would you ever get it? Have you had it? What were your experiences? Why would you get it or why not? I'd love to hear your thoughts. So how does the O shot work in the body? Well, the O shot or orgasm shot is a non-surgical procedure designed to enhance sexual arousal, sensation, and orgasm in women. It involves the injection of platelet-rich plasma, or PRP, derived from the patient's own blood into specific areas of the vagina, including the clitoris and the vaginal wall. Here's how the O shot works in the body. First, the O shot begins with the collection of a small amount of the patient's blood, typically from the arm. The blood sample is then processed using a centrifuge to separate the platelet-rich plasma, or PRP, from other components of the blood, such as the red blood cells. Next, platelets are a type of blood cell that plays a crucial role in tissue repair and regeneration. We activate them using calcium chloride. The platelets then release growth factors and other bioactive proteins that stimulate cellular repair and regeneration processes. Once the PRP is obtained and activated, it is injected into targeted areas of the vagina, including the clitoris and the vaginal wall. The injections are typically administered using a very fine needle and are performed under local anesthesia as well as anesthetic cream to minimize any discomfort. The growth factors and bioactive proteins present in the PRP stimulate tissue regeneration and repair in these injected areas. This process can lead to increased blood flow, improved nerve function, and enhance sensitivity in the vaginal tissues. By promoting tissue regeneration and improving blood flow and nerve function in the vagina and clitoris, the O shot aims to enhance sexual arousal, sensation, and orgasms in women. Patients may experience increased sexual pleasure, improved lubrication, heightened sensitivity, and more intense orgasms following the procedure. It's important to note that the effectiveness of the O shot can vary among individuals and results may not be immediate or guaranteed. However, follow-up O shots will increase your chances of success. After the O shot injections are administered, patients may be advised to refrain from sexual activity or strenuous physical activity for a period of time to allow for optimal healing and tissue regeneration. However, more than 9 times out of 10, a patient can go back to their full activity that night. Some patients may experience mild discomfort or swelling or bruising, and that usually resolves within a few days. Patients should be scheduled for their follow-up appointments to monitor their progress and assess the effectiveness of the O shot treatment. Many times we will do 2 O shot treatments back to back and then assess in 3 months how the patient is doing. Additional treatments may be recommended to get enhanced results. Patients should always consult with a qualified healthcare provider who is experienced in performing the O shot and has the proper licensing required for it. The patient should always be informed fully of the risks, benefits, and alternatives before undergoing the O shot procedure. So, what are the results of the treatments of O shot? So some of the potential results include increased sexual desire. So some women will experience an increase in sexual desire or libido following the O shot. By enhancing blood flow and nerve function in the genital area, the O shot can help improve sexual arousal and responsiveness, leading to greater sexual desire. Next is improved lubrication. The O shot aims to increase vaginal lubrication by promoting tissue regeneration and hydration in the vaginal walls. As a result, women may experience improved natural lubrication during sexual activity, reducing discomfort and friction. Number 3, enhanced sensation. By stimulating nerve regeneration and enhancing blood flow to the clitoris and vaginal tissues, the O shot can lead to heightened sensitivity and sensation during sexual arousal. Women may experience increased pleasure and sensation during sexual activity, leading to more satisfying orgasms, stronger orgasms as well. Many women report experiencing more intense and pleasurable orgasms following the O shot. By improving blood flow and nerve function in the genital area, the O shot can help enhance the intensity and duration of orgasms, leading to greater sexual satisfaction. Improved sexual function. Overall, the O shot aims to improve sexual function and satisfaction in women by addressing various aspects of sexual dysfunction, including decreased arousal, lubrication, sensation, and orgasm. Women may experience improved sexual function, increased confidence, and a greater sense of intimacy and connection with their partner. So, who should or should not receive the O shot treatment? Well, determining who should or shouldn't receive the treatment depends on various factors, including individual health status, medical history, treatment goals. So while the O shot may be beneficial for many women seeking to enhance sexual function and satisfaction, as well as decrease urinary incontinence, there are certain considerations and contraindications that healthcare providers take into account when determining candidacy. Some of the factors to consider should be women with sexual dysfunction. So the O shot may be suitable for women with sexual dysfunction, including decreased libido, arousal difficulties, vaginal dryness, and difficulty achieving orgasms. Postmenopausal women also will experience vaginal dryness, decreased lubrication, or changes in sexual function due to hormonal fluctuations, and they can benefit from the O shot as well, as it aims to improve vaginal moisture and sensation. Any woman seeking enhanced sexual satisfaction could also be a great candidate. Women who desire increased sexual arousal, sensation, and orgasm intensity should look into the O shot as an option for enhancing their sexual satisfaction and pleasure. Generally, women in good overall health who have realistic expectations and understand the potential risks and benefits of the O shot could be a suitable candidate for treatment. Those who aren't suitable candidates are those who are pregnant or breastfeeding, because although PRP is generally safe in most patients, the safety during breastfeeding or pregnancy has not been well established, and we usually avoid elective medical procedures during that time. Women with a history of certain medical conditions or gynecological disorders such as vaginal infections, pelvic inflammatory disease, herpes outbreak, pelvic organ prolapse may not be suitable candidates for the O shot as well. Women with bleeding disorders or those taking blood thinning medications may also be at increased risk of bleeding or bruising, as well as blood clots at the injection sites. Those with allergies or sensitivities obviously should always consult a provider before getting this treatment, although PRP or platelet-rich plasma has a very low risk of allergies. Women with unrealistic expectations about the O shot should also avoid it. So it's essential that women have realistic expectations about the results of the treatment. They should understand that individual responses may vary and not everyone may experience the same degree of improvement. Successful outcomes with the O shot requires adherence to post-treatment instructions as well as follow-ups. If a patient is not willing to do that, they are not going to be a good candidate for any type of treatment. Women should always consult with a qualified healthcare provider licensed in the O shot before undergoing any type of O shot treatment. You should have your individual health status evaluated, discuss your treatment goals and expectations, and have a personalized recommendation for you. Women should always be informed of the risks and the benefits and alternatives to the O shot. So what's a bonus feature of the O shot? Well, the O shot works by stimulating regeneration and promoting blood flow to the pelvic floor muscles and surrounding tissues. This can lead to strengthening of the pelvic floor muscles and improve support for the bladder and urethra, ultimately reducing the severity of urinary incontinence symptoms. While more research is needed to fully understand the effectiveness of the O shot for urinary incontinence, there are studies that show women experience improvements in bladder control and urinary leakage following this treatment. So by addressing both sexual dysfunction and urinary incontinence, the O shot offers a holistic approach to women's pelvic health and well-being. It's important for women experiencing urinary incontinence to discuss their symptoms with a qualified healthcare provider to explore treatment options, including the potential benefits of the O shot. And there you have it, your starter guide to being able to navigate questions about the O shot. If you still have any questions or concerns, comment them below. I'd be happy to answer them, or you can click the link in the description to book a consultation with one of our experts nationwide. Don't forget to like and subscribe, and we'll see you later.